Good morning, everyone. My name is Mona Mackey, and I'm the director of the Access Community Health and Research Center. And today, I would like to welcome you all to the Access webinar, Confronting Global Crisis, COVID-19 and Refugees. Today, we will focus on the way that COVID-19 is impacting and shaping the lives of refugees around the world, and in particular, the Southwest Asia and North African region. COVID-19 has impacted each and every one of us, has most certainly taken a toll on all of us. The international refugee population is no exception. The living conditions of refugees, like close living quarter and limited access to sanctuary stations, making this population even more susceptible to COVID-19 transmission. If you are interested in learning about other topics related to COVID-19, such as the development of the vaccines and the way in which we could limit transmission, please click on the link that has been just dropped into the chat. This link will take you to a YouTube playlist of our previous webinars. Also, if you have any questions during the webinar, please share them in the chat, which is being monitored, or by using the Q&A feature. We will address as many questions as we can. I would now like to introduce Dr. Adnan Hammad, who will be moderating today's webinar. Dr. Hammad is the president and CEO of the Global Health Research Management and Solutions. He's also the former director of the Access Community Health and Research Center. I want to welcome Dr. Adnan, and I want to thank all our amazing presenters, speakers that are here with us today to discuss this very important topic. Dr. Adnan.
Thank you, Mona. And thank you for our speakers for joining us today. We appreciate your time and insights. I'm looking forward to this important conversation. As we all know, refugees communities around the world have had a unique experiences with the COVID-19 pandemic that deserves to be uplifted. Our speakers today is Dr. Yehia Abed. Dr. Yehia Abed is a professor of public health at Al-Quds University, Gaza, Palestine. Dr. Noor Incetahtaci, professor of Department of Sociology, Gaziantep University, Turkey. Dr. Stephanie Nawyn, a professor of sociology and co-director of Center of Gender in a Global Context in Michigan State University. And we are also lucky to have Dr. Ayat Nashwan, Associate Professor, Department of Sociology and Social Work at the Yarmouk University, Jordan, and Dr. Nasser Yassin, Associate Professor of Policy and Planning, Health Management and Policy Department at the American University of Beirut. As we all know, at the beginning of this year, some 79.5 million people have been forced from their homes due to persecutions, conflict, and human rights violations. The total included 45.7 million internally displaced people, 29.6 million refugees and others forcibly displaced outside their country, and 4.2 million asylum seekers. Existing and the new conflicts and the novel coronavirus have dramatically affected their lives in 2020. 30 to 34 million people, almost 38 to 43% of the 80 million forcibly displaced persons, unfortunately, are children. My question today to our esteemed panelists: what are the unique challenges that refugees population are facing during the COVID-19 pandemic? How does equity play into the way COVID-19 is impacting refugees? We know, for example, that Human Rights Watch are reporting that some government COVID-19 vaccination programs are leaving behind marginalized communities, including refugees and migrant workers. So we need to, your perspective on this, a question representing your seldom knowledge on this topic and your country. And we are going to start with Dr. Yehia Abed from Gaza, Palestine. Please
Thank you, Dr.
5 minutes, please. I'm going to tell you stop after 5 minutes.
Okay. Thank you, Dr. Adnan. In reality, that the situation of refugee in Gaza Strip does not differ from the situation of any refugee anywhere, because the refugees in general are sharing common risk factors. First risk factor is overcrowdedness. In Gaza, for example, we have 5,000 inhabitants living on each square kilometer, and this is one of the highest in the world. Access to sanitation and sanitary facilities is lack for all refugees wherever they are. Use of personal hygiene and facilities for personal hygiene is lacking in refugee in general. Then, deterioration of economic situation. They don't have other alternatives because availability of the money is less. And beside access to health services, refugees in general have problems in access to health service, whether these services for the refugees or for the host country. And finally, it is a psychological impact on the people who experience the refugee status. Gaza has a unique situation. As I said, it is one of the overcrowded area. Secondly, if you look, you will find 75% of the population are refugee. Thirdly, they are not acute refugee status. This is chronic. In chronic refugee status, you will find health system belong to them. So they have UNRWA system serving them. And this UNRWA system is cooperating well with the governmental system. This is saved a lot in Gaza efforts, saved life, morbidity, and mortality. Besides that, if you look for the WHO guidelines for responding to the community spread of COVID-19, in the 10 boxes, you will find representative of refugees in form of UNRWA providers are represented there. In the national committees, in the lab committee, in the development of protocol, whatever they are here in Gaza. Besides that, for the surveillance system, the refugees are sharing the non-refugee population in one surveillance system for COVID-19, and they can be informed of what is going on. More than that, there are two positive issues came from UNRWA for the refugee people and for the non-refugee people. The first issue is maintaining the basic health services. This is a recommendation of WHO to keep the vaccine for the population, to care for aged people, to care for non-communicable diseases, and they succeeded to do that. But the last success of the refugee and refugee organizations here in Gaza Strip, that they opened all UNRWA centers for immunization for COVID-19 for refugees and for non-refugees. Anyone is registering in these centers, they receive their vaccine. Government is supplying with the vaccine, but they have good infrastructure. They have excellent staff working with UNRWA, so they participated in giving immunization for all population in Gaza. And I don't feel that in Gaza Strip, any of the refugee is deprived from his right for hospital admission, for a primary healthcare service, or for receiving the vaccine. Thank you.
Thank you, Dr. Yehia. We go to Jordan. Jordan has been a host of refugees since 1948. It has old refugee problems and new refugee problems. Dr. Ayat Nashwan, could you please elaborate on the refugee status in Jordan and how vaccination has been handled in Jordan.
Thank you very much, Dr. Adnan. It's a pleasure to be with you today. I have a presentation actually I would like to share with you if possible. And I promise not to exceed the time. So hopefully I can present what I have today. So I will speak in general because the topic is really wide. I divide it into two parts, but the main or the major topic would be the impact of COVID-19 on refugees in Jordan. I hope you see my screen now.
Yes.
I would like to start with this quote, since we really need to hear from the people. We really need to empower them by hearing and giving them agency. So the majority of the information that comes from different reports and resources comes from the people. This is why I would like to say that, as we know, to speak is to take power. Whenever we become the speaker, we are the empowered. So I wanted to show that from the perspective of the people through this quote. Giving you this overview about refugees population in Jordan, with more than 745,000 UNHCR registered refugees from Syria, Iraq, Yemen, and 52 other countries, plus an estimated of 600,000 registered Syrian refugees and 2 million Palestinians. I would like to have this table in front of you to say that Palestinians still form the largest number, with having both. The majority of Palestinians in Jordan have the Jordanian citizenship plus the status of refugees because of right of return. So they form more than 2 million. Iraqis, 65,000. Syrians, 660,000. And I want to indicate here that these are the registered numbers, which means that the number of DOS, the Department of Statistics, is much higher. Sudanese, 6,000. Yemenis, 15,000. And Somalian, 800. And other nationalities, 2,500. And these numbers taken from UNHCR 2019. But as I mentioned, these are the registered. Going to the governmental numbers and DOS, Department of Statistics, Jordan received over 1.4 million Syrian refugees fleeing persecution and seeking protection. The majority arriving between 2012 and 2013 from Daraa, followed by Homs and other areas. As I mentioned, the majority of Syrian refugees reside outside the camps, with formation of 85% residing outside the camps and only 15% living in the major three camps in Jordan. Speaking about COVID-19 and refugees, the novel coronavirus has for sure devastating influence on the world's most vulnerable population, including refugees and displaced persons. Of the 5 million and over Syrian refugees around the world, 1.5 million presently reside in Jordan, either in refugee camps or in urban and rural areas. And I have some actually more details. I would like to pass them to go to other information about the exact number of Syrian refugees inside each camp. I will be very happy to share this presentation later on. As of September 8, 2020, the first 2 cases of COVID, this is the history of, the subjective of Syrian refugees to COVID in Jordan, had been identified in Azraq camp for Syrian refugees, which is home of over 40,000 people. This is despite efforts by the Jordanian government to limit movement both in and out refugee camps through the enforcement of the defense law to enforce curfews. In the Jordanian refugee camps, the UNHCR and other partners, with the support of the Jordanian Ministry of Health, provide health and humanitarian support to respond to COVID-19. Refugees outside camps can access Jordanian health services for a nominal fee. I would like to say that Jordan was one of the very first countries to give vaccination to Syrian refugees, but I will go to that later on in my presentation. According to a report by Riva, the effects of the lockdown are being felt across a wide spectrum of Jordanian society. However, refugees are in a particular risk of contracting the virus. The National Defense Law of March 17, 2020 gave security forces widespread power to control movement. Syrian camp residents have been isolated, staying at home all day and night since the beginning of COVID-19 outbreak to prevent a potential spread of the virus in a densely populated dwelling. According to UNHCR Jordan, there are fears that if COVID-19 were to occur among refugee populations, the disease could spread easily and quickly in the camps, since thousands live in a tight quarters and camps are equipped with only basic health and sanitation facilities. In addition, a large portion of the population are children, and it's hard to make them understand the need for isolation and extra hand washing. Now, there are different impacts, Dr. Adnan, but I will start with education, because education and health, they were the main sectors that were affected, as other Jordanian as well. Many students are away from school, they study online, and we all aware of the issues of studying online or through technology. It's even harder for refugees to secure the technology and laptops and computers, and couldn't happen without the support from the national and international entities to support them, at least to continue their education. So when the national-wide lockdown was announced, Jordanian government closed 32 schools in Zaatari camp. I actually focus on the camp because outside the camps, the situation is very similar to Jordanian, because they live within us. I'm speaking about 85 percentage, 85% of Syrian refugees are outside the camps. So they are our neighbors, they are our friends. Many challenges were associated with using broadcasts for education through Jordanian TV channels. And this has raised a very important issue to the Ministry of Education to kind of change platforms. But unfortunately, the situation still exists. Also, according to a recent study, 2020, the suspension of schooling and social programming as a containment efforts in response to the possible spread of COVID-19 will also negatively affect Syrian children in Jordan, 40% of whom are already out of school. Remote learning is being piloted by the MOE, including lessons delivered via national television, a website, and smartphone apps. Although the suspension is temporary, the current solutions do not take into account the lack of resources available to both refugees and low-income Jordanians.
2 minutes.
I will pass that. Okay, should I speak about health or I will go back?
You have 2 minutes.
Okay. Sorry, Dr. Adnan, I couldn't hear you.
I said you have 2 minutes left.
Okay, fine. So I will pass very quickly on the impact of health. We all familiar with the protection procedures that is taking place. So the Ministry of Health, alongside with UNHCR, try to, spread the vaccination. But I'm coming to the number of vaccinations that taken place, all of that about health. Also, labor market was really affected because many of them, even who work legally or illegally, they lost their jobs. And this is according to a recent report by ILO and FAFO. Maybe we can discuss that more regarding the labor market. I'm very interested in labor market and the Syrian refugees integration in the labor market. Going with the last topic that I will discuss, refugees and vaccination. So refugees are receiving their COVID-19 vaccination in the camps vaccination centers in Azraq and Zaatari, both previously approved by MOH and the crisis management team. In Azraq camp, the center was activated on 15th of March 2021, while in Zaatari, the vaccination center already started its services on 15th of February. Prior to the center's activation, refugees had to commute to receive the vaccination in Mafraq and Azraq. So these are the numbers of the, in total, actually Zaatari counted 16 COVID-related deaths, of which 5 were reported in March. The number of active COVID-19 cases by the end of March amounts to 120 in Zaatari. In Azraq camp, the number of active corona cases as of 31. So regardless of these numbers, I believe the situation under control, specifically with the increasing of number. So in total, 1,800 individuals have taken the COVID-19 vaccine, out of which 568 have received already two doses. By the end of March in Azraq, 1,507 refugees have registered. So I believe for the Jordanian government or even the UNHCR, giving vaccination to refugees is a priority because the spread of COVID-19 in the refugee camps would be resulted in a very catastrophic situation. And these some statistics about also the number of people who received the vaccination in Azraq camp. And these are some of the references. And thank you for your attention. Thanks.
Thank you, Dr. Ayat. Thank you for your statistics and perspective on this topic. We know that Jordan is a host and a very experienced country dealing with refugees. And please, it is okay to actually talk about the strength and challenges of our countries facing this problem, because COVID-19 is an international problem. It's not just a country problem. And it is a pandemic that has been crushing into our resources. So I think it is okay to also talk about challenges. We go to Turkey. Turkey is a new country to receive almost 3.6 million refugees, Syrian refugees, in the last 10 years. And in Turkey, when I am in Turkey, people there, they don't say Syrian refugees, they say our Syrian guests or family. So Dr. Noor, could you please tell us the story about refugees in Turkey, numbers and perspectives and challenges?
Thank you very much, Dr. Adnan. Yes, I want to give you a background information about the situation in Turkey. As you have already said, we have almost 3.6 million Syrian refugees, but these are registered numbers. So this is very important because in Turkey, we assume that there are more than 1.5 million which is not registered, who are not registered yet. And not only Syrians, in addition to Syrians, we have a lot of refugees from other countries like Iraq, like Afghanistan, and some African countries. But today I will talk about the Syrians only. I want to underline some points because there are links between these points and the coping strategies during this COVID. For instance, being registered. Yes, Dr. Adnan, I'm sorry.
Yeah.
You raised your hand, yeah.
Yeah, go ahead.
Okay, being registered is very important. And then the background of the refugees is also very important, because when we look at the demography of the refugees, they are coming, I'm talking for Turkey and especially this region, they are coming from Aleppo, from northern part of Syria, and from rural area, from rural part of the Syria. So therefore, majority of the community is illiterate. And the young population is very high. The young population, it means when we look at the daily life of the refugees in Turkey, we see that we have a very high population, majority of them youngsters, children and women. And when we look at the households, Dr. Adnan, we see that in one household, there are 4 or 5 families are living together. So which is very important. And when we look at the daily income and services, majority of this young generation, they are working to bring bread to their homes. So after COVID pandemic, because of this problem, because they were working illegally in informal economy, so therefore they couldn't keep on working, because in Turkey, under a pandemic condition, if you want to keep on working, you have to take an official document from the company that you are working. So you can keep on going to the factory or knitting workshop or wherever you are working. But if you are working illegally, it means you cannot take these documents. So therefore, you are in the front line who is unemployed, or who is going to be unemployed during this situation. So unfortunately, majority of the Syrian refugees who are working, they are now unemployed because of this regulation. But I think I should also brief you about integration and inclusion, because these are the hottest topics in Turkey now. Employment is the key to integration. And in addition to employment, education is the other key. So when we look at the education statistic, because majority of the refugees are children, Turkey was doing well, I think. We were improving the statistical numbers, were increased in enrollment at schools. But after pandemic, as I said before, because of the conditions in daily life at houses and in economy, we can see that dropout rates are very high among Syrian refugees, and because they need technical equipments to follow up the distance learning courses. So majority of them, for instance, in my perspective with my students, when I talk to them, when I try to encourage them to involve in the courses, they cannot open their cameras because they don't have any privacy at home. They cannot turn on mics or cameras, so they cannot involve truly. When we go to the territory, to the high school level, let's say, we see the dropout rate is very high because they cannot, they don't have these facilities, they don't have economic income anymore, unfortunately. Service providers are not providing any services anymore because majority of the funds were given by NGOs. And now the numbers are very high. And in Turkey, not only Syrian refugees are asking for help, also the citizens are asking for help. So it is another load for the governments and for service providers. But when it comes to healthcare services, according to our statistics, we can say that refugees, these health services are the most satisfied services. In the vaccination in Turkey, we have age groups. There are front lines and we are waiting for our age group. And refugees are also included in the age groups. We are not distinguishing refugees with the citizens. But if you are registered, so this is very important. Every month, when we look at the statistics, we see increased number of registered Syrians because majority of them living in rural areas, they are farmers, especially in this season. So they don't need to be registered because they don't need any official services like social services or other services. So they don't need to be registered. But when it comes to this very important services, official services, you have to be registered to be legal, you know, to be existed, let's say. But if you are not registered, it means government cannot put you in the front line for vaccination. So this is very important. And unfortunately, last year, because of pandemic and because of lockdowns, several months they couldn't register anybody because the offices were not working at that time. And it was a very big problem. But now, some municipalities, for instance, Gaziantep, they changed their, let's say, they changed their programs. For instance, when they have budget for cultural activities, now change it to livelihood activities. They are rescheduling the budgets. As I said, for cultural activities and for other events, it was designed for that. But now they are giving these budget for economic support to everybody in the neighborhood without distinguishing citizens or refugees.
You have 2 minutes, Dr. Noor.
Okay, so I want to give some more statistic about women because unfortunately, women, they were also working illegally at homes. They were working at homes. And under these conditions, majority of the women, they cannot provide any income. They don't have any income. So I can easily say that we need more economic support in this situation. So now we are trying to negotiate and try to find funds only for primitive needs. This is very important for shelters, for any kind of economic income. So we are, unfortunately, we are back to 10 years ago now. We are looking for the most initial, the most primitive needs. This is because of pandemic, but I hope after vaccination, we will start to be back to our daily life. And I believe that next year, when we have another webinar, we will be more, maybe more hopeful.
Thank you. Thank you, Dr. Noor. That's very, very important. And stay tuned because we have more questions for you. We go now to Lebanon. Lebanon, al-Balad al-Jarih, economic crisis, big explosion consequences on people's health and mental health, COVID pandemic, influx of refugees. Dr. Nasser, Yassin, could you please elaborate on all these issues?
Frankly, to elaborate all of these in 5 minutes, it's going to be impossible. But I'm going to focus on the COVID-19 pandemic and how it impacted refugees and displaced population in Lebanon, but also covering the region as a whole. This is a paper we did with colleagues at the Faculty of Health Sciences, a series of papers actually, they will be coming soon. So I'm going to summarize some of the main points and add to it some of my analysis. So, you know, the region is host for 20% of the world's displaced population, including 8 million refugees, around 13 million IDPs. And the reason I want to highlight the problem of IDPs that's actually even more acute than the problem of refugees, and they're lost within their own countries under very severe conditions. So, for example, the IDPs in the region are mostly in 3 countries, in Syria, in Yemen, and in Iraq. 3 countries that have been going through acute crises and conflicts for the past decade or more. And they've been going through the fragility of the system, going, you know, and devastating the condition of people who live in those countries. But I want to add something and say that the COVID-19 is not in itself affecting the people directly, but it's compounding all the vulnerabilities that already exist in nations and in countries hosting refugees and IDPs. And the case of Lebanon is a clear example. You know, I mean, Lebanon is hosting around 1.2 million refugees, between the new ones, as you said, Dr. Adnan, early Syrian refugees, but also Palestinian refugees who've been living since 1948. And their conditions prior to the COVID-19 have been actually quite dire and quite bad in terms of their access to health, access to education, access to livelihood opportunities, or protection. And these are the 4 points I want to highlight and say a few words how COVID-19, you know, compounded those vulnerabilities and fragilities that existed before the pandemic. So in the terms of health, the healthcare, refugees in Lebanon and in the region at large, but in Lebanon in particular, don't have decent access to all types of healthcare. Of course, for Palestinians, they're under the UNRWA mandate. They do access primary healthcare services that are run by UNRWA, but when it comes to hospitalization, they go through a quite challenging journey to access hospital care. Most of the time, it's covered by UNRWA, but it's done by non-governmental hospitals, mostly run by the Hilal Ahmar Palestinian and other bases and other organizations. And for Syrian refugees, those who are registered can access hospital care, but it has to go through approvals, and they have to get, and most of the times, refugees don't know how to navigate access to healthcare, particularly hospital care. They end delaying it until until they get to a situation of emergency when things become too late. So in a country that 82% or 85% of the hospital beds are run by the private sector, they are within the private hospitals, not only refugees, but also the poor Lebanese have struggles and challenges in accessing hospital care. So you can imagine when COVID-19 occurred, there were a lot of obstacles and a lot of challenges for refugees and for the poor Lebanese as well in accessing the hospital care. 57% of refugees, for example, in Lebanon reported how difficult it was for them to even access primary healthcare during the COVID-19. In Syria, for example, IDPs were really struggling to get access to health facilities during the pandemic. We have the data on other countries, but I want to just focus on these. And the second repercussion of the COVID-19 is actually the increasing poverty levels. Almost all refugees in Lebanon, Syrians, almost all of them, and the vast majority of Palestinians work in the informal sector. They work on rely on daily wage, earning daily wages. So they have to go out. They cannot actually have the luxury of the middle and upper classes who can work from home. And that's something that got exacerbated by their conditions got exacerbated during the lockdown. They couldn't go out. So for example, in Lebanon, 60% of Syrian refugees were permanently laid off due to the COVID-19 in relation to the lockdown, because they rely on working on a daily basis, and many of those enterprises or those companies actually were not in operation. Similarly, Lebanese, by the way, who work in the informal sector, were also permanently laid off during the 39% of them during the lockdown. I'm highlighting also the host communities because the challenges are similar, although they're more felt by refugees because they lack the right protection that they deserve to have. The third repercussion is the impact of education, and Dr. Ayat mentioned this. I think in 1 year, we lost all the modest achievements that refugees gained in the past 10 years. In 1 year, the modest achievement of having around 50% of Syrian refugee kids in schools in Lebanon was lost. And 65% of those refugees, Syrian refugees here, reported not having any access to distance learning. And of course, the same for Palestinian refugees, where 30% of them couldn't have internet access. This lockdown and relying on online education was a luxury for many of the refugees. Add to it the economic conditions in Lebanon, the really deep economic crisis that Lebanon is going through had forced many families to actually get their children out of any education and to try to send them to do any job. And some of these jobs were really even very harmful for those. Some actually, to a certain percent, I mean, small percent, but they did actually rely on begging in order to keep going. So the situation when it comes to education and children is really, really very dire. And I think, in addition to the health impacts of the COVID-19, I think the major impact of this pandemic is on education, particularly education for refugees and their vulnerable host communities. And the fourth repercussion is related to impact on protection, various forms of protection, including particularly in the early days of the lockdown, an increased level of discrimination against refugees, where they were asked not to leave their places of residence. Some municipal authorities thought that because refugees are poor, they would carry the disease. They would carry the disease more than others, which of course wasn't true. And it turned out that anyone can get this disease. The prince in the UK, or a poor Lebanese, or a poor refugee, anyone can get it. So that's, and with time, people started to realize that this is not related to poverty or to being in displacement, but still the protection space became smaller and smaller for refugees during the lockdown. But in addition to that, there were reports of increased gender-based violence during the lockdown because of living in spaces that are so limited, because of all the economic pressures and the other pressures on families. There were actually reports from the UNFPA of increased gender-based violence on women, on refugee women. These are still under investigation, but that was reported by the UN. But why all of this? And I want to summarize or synthesize all of this, the reasons for that in a couple of minutes. I think, we can talk hours and hours on the impact of COVID-19 on refugees, on IDPs, on their poor host communities. But we have to dig and understand why actually those repercussions on refugees are felt in this way, why they increased and exacerbated existing fragilities. And the first thing I would like to say, the first point, related to 4 phenomena, I would say, is actually most of the refugees in the MENA region and in the world are living in fragile host countries. 51% of refugees in the world actually live in 10 poor countries in the global south, and those countries are fragile. They go through continuous, stages of economic and political crises all the time. Lebanon is a case. Even Jordan has its economic challenges. Turkey as well, to a certain degree. And of course, look into the other nations in East Africa and in Bangladesh and other places. And most of the refugees are living in those countries. So definitely, such conditions of displacement are going to get exacerbated by living for long years in fragile settings. The second one, related directly to this, is the chronicity of displacement. Refugees now spend, as UNHCR says, 20 years in displacement. The figure doesn't tell us a lot, but actually it's an important point to highlight that the return of refugees to their own countries has become the exception rather than actually the norm. So 20 years of displacement means the refugees are going to have generation after generation in displacement. And this actually, living in fragile settings in many, many years in displacement, under such dire conditions would mean things are going to reproduce itself. And the third point is the geography of settlement and where refugees live themselves. Most of the refugees live among the poor host communities, whether in Lebanon or in Jordan, in Turkey, and even in Europe, they live among the poor because the informal setting where they can live in, they can rent a place, allows them to live there, where they can work informally. But this actually means that there's a geography of poverty and displacement that get compounded with each other to produce such misery. And the fourth element or phenomena here, that the nature of assistance and response have been very limited and has been actually mostly around sending money to those places and doing deals with host countries to get some kind of assistance that would keep refugees there. And we don't talk a lot about the durable solutions. We don't talk about return as it should be, because we cannot actually resolve the actual problems in those countries. And we don't talk about resettlement or any solution that those refugees can go into another place, like a third country. So, those four elements means that the refugees are going to stay for longer years in displacement. They're going to suffer more and more, and their host communities are going to continue to live under extreme conditions. If we don't resolve and understand those four conditions, I think any pandemic, any other economic crisis, any other crisis that will come in the next few years is going to be the same. So these are the root causes that we need to address. I'm going to stop here, and maybe you can address some questions in the Q&A. Thank you, Dr. Adnan.
Thank you, Dr. Yassin. Thank you so much. This is a very good insight about refugee status in Lebanon and in the MENA region. And I thank you for mentioning that 51% of the world refugee problem exists in 10 countries, mostly in the MENA region. We go last to a credible and scientific researcher, Dr. Stephanie Nawyn from Michigan State University. I have had the pleasure to really work with Dr. Stephanie in the last year and a half regarding refugee social distancing study in Turkey, Lebanon, and Jordan. And I hope that she can also mention some outcomes from this study. Dr. Nawyn, could you please come to the floor?
Yes, thank you very much. And thanks to my fellow panelists and to all of the people that are attending. It's a wonderful opportunity to have this really important conversation. So I, as Dr. Adnan alluded to, I have been the principal investigator on a project that has had a really wonderful team of co-investigators, Dr. Adnan and Dr. Ayat included. I can focus my comments on that since I will need to be brief. So we started this study in June of last year. The focus was on service provision to refugees in 4 different humanitarian NGOs operating in 3 different countries, in Turkey, Lebanon, and Jordan. Over the course of the summer of 2020, we conducted over 1,400 interviews with staff at these NGOs, asking them about how well particular safety protocols were followed. And we focused on social distancing, wearing masks, face masks, and hand hygiene, washing, sanitizing hands before, during, and after services. We actually also asked some questions about surface disinfectant. In retrospect, I wish we had asked, instead of asking about disinfecting surfaces, I wish we had asked about air circulation, because as we now know, COVID-19 is spread predominantly through aerosol rather than surface contact. But this is one of the challenges of doing research like this very quickly with the incomplete science about the virus. And the goal of the project was to really look at barriers? What is standing in the way of people following these protocols better, so that we can reduce the risk of infection, both to refugees, but also to the people who are providing these really essential services to them. And so some of the findings really echo what the other panelists have talked about. You know, crowded conditions are a challenge when you're trying to maintain social distancing. We did find that it was particularly in waiting areas. So surprisingly, protocols were followed pretty well, especially hand hygiene and mask wearing during medical services, for example, and social distancing often had to be violated, but was done so really minimally. It was in the service areas, or the waiting areas, where people not only were violating social distancing, but like would pull their mask down so they could talk to the person, you know, sitting next to them. Face masks became really unaffordable during this period. Of course, everybody who's had to, you know, maintain these supply chains during summer of last year found that you know, all PPE became really expensive. And of course, in Lebanon, with the explosion in Beirut and you know, the very volatile currency, that was challenging for refugees, and the NGOs didn't always have spare masks to provide for them. There were limits in certain services and certain protocols in ways that I found at least to be a little bit unpredictable. I would not have necessarily guessed this going in. One example we have is services to children, where you know, understandably, social distancing tended to be violated more during those services, and staff explained, well, you know, a child needed their shoes tied, a child had an accident, and we had to help clean them up. But hand hygiene was best during services to children. And I think there's some lessons there about how we can improve hand hygiene practices in other services as well, that I can talk about more in the Q&A. Over time, fatigue following these protocols was certainly an issue. Staff described refugees as becoming bored, exhausted with, you know, it requires a heightened sense of surveillance of yourself and others. And I think all of us who have had this issue with, you know, do I go out today? Do I go into this market? Do I have a mask with me? You know, it wears on you. And we've been doing this now for 14 plus months, most of us. You know, fatigue was certainly an issue. Also accessing reliable information. And, you know, staff, of course, we did not interview the refugees themselves because this was a rapid response project that had to have results produced very quickly. We weren't able to talk to the refugees themselves, but staff said, well, refugees they lack good information. What we found, though, is that staff themselves sometimes lacked good information. They often told us, well, I wear my mask around refugee beneficiaries, but I don't need to wear a mask around other staff. I know that, you know, we know each other, we trust each other, we know we haven't been exposed to someone who's sick. And so even that is obviously, since anyone can get this, and anyone can be a pre-symptomatic spreader of COVID-19, this is not great information for staff to be working on. And then we also saw a surprising amount, maybe not surprising, of COVID skepticism, particularly among refugees. So in addition to the interviews, we had data collectors go into service spaces and make observations. And they were to record every time they overheard somebody say a comment that indicated that they weren't taking COVID-19 seriously. And in almost a third of the 215 observations that we conducted, our data collectors heard comments indicating some skepticism about the seriousness or even the reality sometimes of COVID-19. And I think that is an issue not just for following safety protocols to reduce infection risk, but it might also spill into vaccine hesitancy, which is, of course, something we really want to be thinking about as we go into this new stage of the pandemic, where we try to achieve herd immunity through broad vaccination. So I'm I'll stop there. I'm really happy to be on this panel with such a great group and look forward to questions.
Thank you, Dr. Nawyn. We still need you for other questions. Please stay there. For people forced to flee, COVID-19 became an additional protection and livelihoods crisis on top of the global public health emergency. The virus has unfortunately disrupted every aspect of a human life and severely worsened existing challenges for the forcibly displaced and stateless. Some of the measures to curb the spread of COVID-19 made it harder for refugees to reach safety, and new asylum applications have dropped by a third compared to the same period in 2019. Meanwhile, the underlying factors leading to conflicts globally remain unaddressed. These are the big issues that we are facing. With that said, and my question to all panelists now, how might international governments support the refugee populations in overcoming the COVID-19 pandemic? What types of aid might be provided by government around the world? And with that said, what can we do to support refugees through COVID-19? In 3 minutes for each panelist, I start with Dr. Abed. Could you please elaborate on these two questions? How might international governments support the international or local governments?
Okay. In reality, that Gaza passed a hard experience in this, and Gaza was lucky enough that the internal cases of COVID-19 appeared 7 months later. So there was delay. That delay was due to severe restriction of the movement on all travelers. They were quarantined for 21 days, not 14 days. This delay the occurrence of the disease 7 months. These 7 months was enough for the Palestinian refugees and all the Palestinians to get help and assistance from outside countries, mainly through World Health Organization and through friendly countries. During this time, needed basic issues were prepared, and intensive care units was prepared. Oxygen was given by a good amount of station. All this support from international body to the Palestinians help a lot to minimize the huge expected risk that was expected if COVID enter an overcrowded area with deprived localities and so on. In reality, I considered there was a great effort. That effort was supporting the lab facilities. It supported the intensive care unit facilities. It supported training activities in Palestine. And besides that, it supports immunization for the population. So we have this contribution to the Palestinians, especially in Gaza Strip.
Thank you, Dr. Abed. Dr. Ayat Nashwan, in 2 minutes, how can you answer this question? How might international governments and your government support refugee population in overcoming COVID-19 pandemic? What type of aid might be provided to those refugees? And how can you assure equity in vaccination as a marginalized community?
Thank you, Dr. Adnan. As I mentioned before, refugees were a priority, and Jordan was one of the first countries actually that give vaccination to refugees. And this is really evident. I would like to say in general that it's a shared responsibility Unfortunately, many international bodies, they did not meet their promises to Jordan through Jordan Compact. This is why the economy is still suffering. And I would agree with my colleague, Dr. Noor from Turkey, that if we make procedures to improve the economy, everything will be improved as a result, because many of the refugees who even work legally or illegally, they lost their jobs, as what happened in Lebanon as well. So I try to mix the situation. We live in the Middle East and we share even similar stories. So I believe the role of the local was really surprising in Jordan. We saw that many local organizations, they took a role in combating the virus, COVID-19. So Jordan has a great and a large experience in dealing with refugees from different countries, but not with COVID. So COVID is new to us. So I believe that we should rethink of our strategies. We really need this unite efforts and also coordinate with our other countries that are affected from the Middle East, our colleagues in Turkey, Lebanon, Palestine as well. Thank you very much.
Thank you, Dr. Ayat. Dr. Noor Stimbashi, can you elaborate on this question in 2 minutes?
Dr. Adnan, I want to brief you about a recent research conducted by Gaziantep University Department of Sociology in Gaziantep, Kilis, and Urfa. These cities are neighboring cities to Syria and had the highest number of refugees. And according to this research, I can say that the problems like economic problems, like Professor Nevi has already mentioned, reliable information and lack of communication in Turkey, we have language barrier problem. These problems appeared again and deepened, unfortunately. So this is a very big risk and very big problem subsequent for integration, for harmony and discrimination and for everything. So in order to prevent these, I think it's very important, as Dr. Ayat has already stressed, the international community is supposed to think that this is an international problem, not only Turkey, not only Jordan's, not Lebanon's. This is a humanitarian issue. They have to take responsibility with us. It's not easy like sending money to us and okay, take care of them here, there in Turkey, don't let them come to Europe. It's not like that. We are talking about something beyond this, I think. So as Professor Ayat already stressed, I think everybody has to take their responsibilities and support each other's. Economic problems are in the front line, it's for sure. In Turkey, we have language barrier and reliable information problems. According to our research, refugees, they trust their own communities to get information about COVID. Not national channels or not governmental channels. They trust their own NGOs, their neighbors, their relatives instead of government. This is very important, I think. This is so for sustainable recovery. I think to provide workplace safety, transparency, and reliable information channels is very important because now Turkey is, I can say that, medium income country. And now majority of the citizens, they are thinking that they are sharing their incomes with Syrians, which is not true at all. So transparency is very vital in that point. Reliable information to prevent some other misunderstandings. And I think when we compare to Jordan and Lebanon, we have language barrier problems, integration. And this is also appears again right after this pandemic, after 14 months. That's why I said we are back to the beginning, because I think we lost all the things that we have gained through this period, unfortunately, after pandemic.
Thank you, Dr. Thank you, Dr. Noor. Dr. Nasser, Yassin, could you please elaborate on this question? And can you please shed light on the issue? Does Palestinian and Syrian refugees in Lebanon have access to vaccine as their Lebanese nationals?
Yes, I was going to highlight the issue of vaccination. They do, definitely, they do have access to vaccination. The problem of the vaccination rollout has been very slow for everybody. but slower for refugees because of the people have to go and register through a platform. I think most countries are doing the same. So refugees have either limited access to registration on the platform, or they require more convincing. So among the 1,100,000 or 1,200,000 people who registered on this platform, only 6%, or actually 6% are non-Lebanese, 4% are Palestinian and Syrian, 2% Palestinian, 2% Palestinian. So the percentage of registration even to the platform has been very, very slow among the refugee communities. So we need to raise more and more awareness among all communities in Lebanon, particularly in refugee settings, in order to encourage them and maybe support them, even get social workers and health workers and community workers to go to the communities and support them. And it's very simple, yet it requires digital literacy. I did it for my parents. They know how to use the phone, and I still have had to do it for them because you're required to go through 3 steps of registering that. So that's on directly on that. There's no discrimination against refugees whatsoever when it comes to vaccination, but it's been very, very slow for those reasons. In addition, the COVAX platform, where the countries register through to get the vaccine, and Pfizer as well through the private agreement or the agreement with Lebanon, they offer free or highly subsidized vaccines for refugees. So among the 5-point-something million vaccines that Lebanon will get from Pfizer, there's 1 million or so are given free because of Lebanon hosting refugees. And we and others in civil society and in the academy, we've been monitoring the process on a weekly basis. We know we ask for information, we dig for information, we publish them on a weekly basis in order to raise awareness about that. Now, what we need to do for this, honestly, we need the global north to be less, interested in their own people only. I lost the right word to put it diplomatically. So 80% of the vaccines are in the more developed nations, and 0.5% of the poor nations got, and only 0.5% of the vaccines got to the poor nations. This is going to draw a line in the world between those vaccinated and those not vaccinated, those that will manage to open their economies and those that will not manage to open their economies. So things are more complicated than just getting millions of people in 100 million in 100 days. Actually, it's actually about the global solidarity that we need to build. And to do so, we need to release the vaccines to go to those places. That's the message we need to do. We don't need charity. We don't want, to clean cleaning kits and hygiene kits. People know how to clean themselves. We need actually to release the property and copyright of the property right of the vaccines. We have in this region places where we can produce the vaccine. In Jordan, to give an example, they have a well-advanced pharma sector. In Egypt as well. So this is where we need to work on.
Okay, thank you, Dr. Yassin. I think you have raised in your previous answer a very important question, that the majority of our refugees are actually living in countries, in developing countries, that also are, relatively speaking, countries that are struggling with their own population. According to the United Nations, 86% of the refugees are hosted in developing countries, and this is a problem by itself. Dr. Nawyn, can you please share with us your perspective about how how the global north can support the global south when it comes to equity and vaccines among refugee and underserved communities?
Yes. So, I want to echo what some of the other panelists said about, really that we need to have sufficient access to vaccines everywhere. When the outbreak first happened, people talked about, well, this shows we're all in the same boat, but we're not all in the same boat. We're in different boats, but we all are in the same storm. And that storm is going to end up on, it already did, ended up on everybody's shores, right? And I think what we have to think about is if the vaccine rollout in different parts of the world takes too long, that's going to provide more opportunity for the virus to mutate. And with additional mutations, the vaccines we currently have may not be as effective. And so everyone across the planet has a vested interest in making sure that we stop the virus in its tracks. And the only way to do that at this point is to get as many people vaccinated as possible. And so, I think things like Dr. Nasser, as you pointed out, the copyright, right? The patent protections on these vaccines needs to be lifted. We need get sufficient access to all refugees. We need economic support, I think, during the vaccination procedure, especially if we're talking about Pfizer, Moderna, other vaccines that require 2 doses. Some of these vaccinations make people ill for a day or 2. And if they think they're going to miss work and lose their jobs, they may not want to take the vaccine, right? And so it doesn't have to be, we've been talking about this forever, right? Since the existence of refugees need economic support, and consistently they get too little. If we can get international governments to see this as this is very directly in your self-interest, give an infusion of economic support, long-term economic stability is needed, but in the short term, we absolutely have to get people through this vaccination period. And then Dr. Nur, what you had pointed out about what the information sources that refugees trust and those they don't. There certainly are ways that global North governments can put resources into pro-vaccine campaigns, but utilize cultural networks, right? So that the information is co-created by co-ethnics, is distributed through networks that people trust. It doesn't have to be a commercial that's produced or any other sort of media campaign produced by a U.S. government or the UN. It just needs to be paid perhaps by those sources, but really needs to utilize the sources of information that people already trust. And those networks exist. Right? They don't have to be built. They just have to be utilized. And I think really thinking about this as, everyone's vested interest is to get as many people vaccinated as quickly as possible. Our study focused on safety protocols, but honestly, those haven't really, they haven't isolated the virus. There's only a few places in the whole world where they've been able to use safety protocols to reduce spread. For most other places, the only way we're going to get this under control is to vaccinate people. And I think that's really where governments should be putting their resources.
Thank you, Dr. Nawyn. Thank you so much. I think in conclusion, we can conclude that availability of vaccines is important. Host countries face challenges in obtaining COVID-19 vaccines, since 86% of refugees are living in developing countries. Lack of information about refugees and migrant workers needs to improve. Raising awareness, build confidence in the vaccine, and having a national strategy for educating refugees and migrant workers to actually get vaccinated. And obviously, we need to improve and advocate for international standards. No discrimination on the national origin is against international law. And with that said, I want to thank our panelists for taking the time to discuss this important topic. And I want to thank you, everyone who are tuned into this conversation today. This webinar will be recorded and will be distributed or disseminated to our social network with Access and other partners. And thank you so much for your contribution. Thank you.